So if we want to diagnose Cushing's in our patients, what I always recommend and start with is a blood test. I have maybe clinical suspicion. I have reasons to think this dog might have Cushing's. So I'm going to say, yep, let's go ahead with a test. And that first test I'm going to run is called a low-dose dexamethasone suppression test, LDDST. What this test does is it's a series of blood draws where we measure blood cortisol levels. We're going to measure the baseline cortisol in this dog's system. And remember, that's the stress hormone that comes from the adrenal glands. Then what we're going to do is we're going to give a very, very tiny dose of an IV steroid called dexamethasone. And what that steroid should do in a normal dog that doesn't have Cushing's is it should suppress the cortisol levels, because it should basically say, oh, here's some extra steroid. We don't need to make more, okay? And so then we take more blood in 4 hours after we give that steroid injection, and then blood again at 8 hours after we give that injection. And we send all 3 of those blood samples out, and we get measurements of cortisol in all of those time points. And a low-dose dexamethasone suppression test is the way a lot of vets start when they're trying to test for Cushing's. And the reason is that test can potentially give us a lot of information.